Okay. Today is March 10th, 2021, the Wellfleet Board of Health virtual Zoom meeting. First on our agenda is a well variance for 935 Chequesset Neck Road, Wellfleet, map 9, parcel 99, Kevin Keegan, Desmond Well Drilling.
Same issue as before, high salt, and we're looking for a variance to regulation 504 to put it on someone else's property. Jackie
Okay.
Faust's very generous.
Okay. And the water test on the, where the well is gonna go?
We haven't tested it yet, but Jackie has suitable water on her own property. And
Okay,
we've had good luck over there with the other 2 wells.
okay, great.
I just
Any
have a question
questions?
for Hillary.
Yes.
Do you have a copy of the easement, Hillary?
You know, I have seen the easement. I don't have a copy of it in front of me for this particular property.
We should, just as a housekeeping thing, should probably get
Yep.
that.
Sure, the
Yeah,
easement
I
from
agree.
Jackie allowing them to place the well there.
Yeah.
Yep.
That's my only concern.
Yes.
Okay. Are there any other questions or
Will
comments?
that be a once a year water test or is it
That
not
was my
necessary?
question.
We recommend it get sampled once a year, but it's
Okay.
really up to the property owner.
Oh, okay.
Okay. Could we have a motion for that then, if there's no further discussion? Nick, you have anything else? Any other questions?
No, I think we're, I think, didn't we addressed this
We did,
previously? And I
yes.
think that things were, okay, that's what I thought.
right.
I'll move
Okay.
that we
Okay.
approve the well variance for 935 Chequesset Neck Road.
I'll second.
Second,
Yeah, I'll second.
all in favor? Aye.
Aye, Nick,
Aye.
aye.
Okay.
Okay, thank you.
Thank you,
That's our
Michelle.
meeting.
You
Thank
did
Thank
good
you
on
very
that.
much, Michelle.
Bye-bye.
Okay,
Bye.
bye-bye. Okay, there's no other variances requested. Next is our COVID-19 update from our fearless leader who is thick-skinned, big-hearted, and thinks well. And that would be Hillary Greenberg, and we can put that in the minutes.
Oh, that's who you meant. Okay.
Yeah.
What a nice boost there, Janet.
Well,
Wow.
it's true. I see her on so many Zoom meetings. She's marvelous.
Oh, well,
Good.
gee, I appreciate that, but are you
Yes.
sure?
I'm sure.
You just like the hairdo, Janet.
Of
So-
course, I've gone to Gillette for my vaccination, but so I'm still sure.
Okay, well, I told you to wait a little longer. We might have been able to help you out, but as far as
Maybe, yeah.
COVID goes, today we have 4 active cases. So we seem
Okay.
to be hovering, between 4 and 6 cases every 2 weeks when we go and run the reports to look at the numbers, which seems to be about average for us. We have a second dose clinic coming up on the 18th at Little Creek in Eastham. And for that first clinic 2 weeks ago, we did target our most senior and frail folks in the community to get them vaccinated. And what we found was a majority of them had already been vaccinated, which was great. So we were able to pick up some of the stragglers and send them to Eastham. And we were able to work down the list into the 60s. So we got some folks in the upper 60s out there to get vaccinated, which was great. And I think we even had 2 folks from the school that were able to get signed up because of this reason or that reason. So that worked out really well. And shortly after we held that clinic, the governor said you could no longer hold closed targeted clinics. All vaccine needs to be used for everyone who's eligible. So that being said, we continue to advocate for more vaccine out here on the Outer Cape because it doesn't seem equitable that all the vaccine is going off Cape and that our seniors, out here in our rural communities have to get in the car and drive over an hour to get a vaccine off Cape somewhere. So we continue to advocate. I'm not sure we're even being heard, but we continue to push the matter with our DPH representative at our Health Agent Coalition calls. So I'm hopeful because we pushed extra hard this week to get something in writing back from them next week at our meeting. So we'll stay tuned to that. We are going to go out and vaccinate our homebound starting the week of the 15th, which is next week, working with Outer Cape Health and the fire department. So that's exciting as well. We have about 25 individuals that we're going to get at that way. So we're working all the channels here as far as vaccine goes. So I'm feeling good about that, and it's kind of satisfying work. So it's promising.
I have a question
Well, Hillary,
based on land. I'm sorry.
No, I'm sorry.
Thank you, Bill.
No, I was just going to mention, Barbara and I are getting vaccinated at Outer Cape in Wellfleet this Saturday.
Yes, perfect. Yeah,
Good.
so
Yep.
they're taking,
They're starting to reach out. They are,
yeah, it's great.
To
Okay,
their
that's good.
patients only, right? To their
No, no.
patients.
No, because they're a community health center and their funding is federally funded, they will vaccinate anybody. You just have to call and get on the list. You have to be in the eligibility criteria, but
Yes,
if you're
okay,
eligible, they'll sign you up.
okay. I have a couple of questions from last night's select board meeting. It was mentioned a few times by a couple of selectmen that we still have a number of people over 75 who have not yet had their first vaccine. And yet we're opening up, I guess, Monday opened up for teachers, et cetera. So there was a concern about that. I know our estimation is based on census, but not everybody who's maybe over 75 is on our census in Wellfleet. I'm just talking about in Wellfleet now. Do we have any handle on that? How many people over 75 we still need to reach?
So we've reached out and we've put the word out on a number of different channels that if you need help, call us. If you need help, call the COA. So
Okay,
that message is out there loud and clear, I think, at this point. We did call all of the folks in town that we have on the from the town clerk census over 75. And so we've reached out to all of those individuals.
well, that's nice to know.
If there are other folks sort of lingering, or I guess I feel like at this point in the pandemic, people know how to reach us.
Yes,
And
yes.
if they don't, then I'm going to question whether they really want the vaccine anyway,
yeah,
because
right.
like I've fielded hundreds of calls from people. Lot of second homeowners even call and they are eligible because they're living here. So everybody gets the same message. And I
I
think,
see.
so I think we've reached them. I feel like we've reached them. And if we haven't, there's always time to reach them while we're waiting for more vaccine. I just don't know how to get at them. So we've sent out a couple of the civic alerts. We've used a Facebook page, some social media. We've, talked about it at selectmen's meetings and emergency management meetings, and it's in the newspaper, it's on the TVs. So I'm hopeful that people know how
Right.
to find us if they haven't
Yeah.
found us yet.
And I think it'd be important to put that in our minutes based on last night's meeting. That it was openly stated to the community that there were lots of people, that was the quote, over 75 who had not been, were not eligible or not able to get vaccinated. So I think it's important that all of the efforts that you have made
Yeah.
and that we've made locally be documented somewhere to say that this has happened. So because it is a decision, an individual decision, so you can only
Yeah.
do so much,
Yes.
But
Well,
the
and
fact
I
that we use the
wonder-
census and
Yeah.
Yeah.
I would say, I wonder what they're basing their information on also.
yes,
That's
this is
exactly
what I'm
what I was
saying.
gonna
That's it,
say.
yeah.
Because we actually boots on the ground called all these people. So
Yes, and
like,
I think documenting that is important
yeah.
so that people know that.
And
I
think
shall
we were-
document it.
We were
Thank you,
surprised-
Rebecca.
Thank you,
Well,
Rebecca.
We were surprised at how many folks had managed to travel to get their vaccine. So like,
That's right.
it was shocking to us actually, like how many people were vaccinated, because you would never have known that based on the number of calls we were fielding, or like,
Right, right,
and sometimes I think that squeaky wheel is just what like sticks with you. So
right. Or is Julian Sear and Sarah Peak still involved in purporting for us to get an Outer Cape availability of vaccine
no, well,
the way they were?
I shouldn't say no. They worked on this Cape Cod consortium, which funneled more vaccine to Cape Cod Healthcare, but Cape Cod
Okay.
Healthcare hasn't opened up. They don't have a clinic, so they're calling their patients, and they are going to work through folks that have difficulties signing up or have difficulties navigating the online system. But out here, we have such a close relationship with Outer Cape Health that
Yes.
we've worked with them hand in hand to get our people done. So we actually, when push came to shove, we didn't even have a list to give to Cape Cod Healthcare because we only had a couple people remaining, and we sent them over to Outer Cape Health of those that
Okay.
need it and have
Excellent.
reached out. So
Okay, good,
Very nice.
good.
Okay. Thank you, Hillary.
Okay,
yeah,
Thank
good
you,
job,
Hillary.
Hillary.
Pay as you throw.
Yes, new business, pay as you throw.
So we have Jay and Mike here to talk to us about bringing back purple bags.
Are you
Take
Excellent.
it
looking
away.
forward?
Moving forward.
Fun topic, huh?
Yes,
So yeah, how you doing, you guys? I'm Jay Norton. I know I've seen you guys before. Good to see you again. Mike Sakali's on the line too, and we're here for any questions you guys have. I'm not sure what format you guys want us to present, if any. And I'd just like to hear from the board too, to see what their opinions are on re-implementing the program.
I like
I
the
don't know how
color of the
you all
bags.
feel about it.
Are you comfortable with the safety, Jay, and reinstituting the program?
Yes, absolutely.
far
I
as your-
think,
okay.
You know, I talked with Mike, I talked with Mark. I think at this point, we're ready to re-implement it. There's a number of reasons why we feel like it would be a good idea at this point. Obviously, some of the reasons why we suspended it was for COVID related purposes, to provide financial relief for residents. Kind of deterring people from going to the store and, purchasing the bags. And the advantages to continue the pay as you throw would be to, delay a potential sticker increase if we didn't go back to that because we're paying so much in MSW.
Okay,
So we do,
The
we
economic
definitely
is-
need to go back to that because obviously the town receives revenue from the bags.
Okay.
So if we didn't go back to the bags, we would definitely have to look at the fee structure and determine, what we'd have to do with that.
We also get points for grants for having the pay as you throw system in
Okay.
place. We get money
Correct.
from the state for having it, which is another, selling point.
so there's no existing barrier to reinstituting it at this point, save what we anticipated was financial individually, right? Is that what
Correct.
we're saying? Yeah,
Yeah.
okay,
Yep. So we were thinking, a good time to reinstitute this would be after Memorial Day, which would fall on June 1st.
June 1st.
Wow. All right.
Yep,
Wow.
so that would be, it's a nice number for people to, a date for people to remember. It gives people time to purchase the bags and get back into that kind of regimen. So that would be
How
our
about May 1st?
recommendation.
how about May 1st?
Yeah, I was. Yeah, I
I
was
think-
I mean,
anticipating
that's
sooner.
certainly
yeah.
up to you guys.
I think June is reasonable, though.
we just
to really
want-
get-
Yeah,
to
I
get-
mean, it's been so long since people have been using purple bags. I think they're gonna have to digest it for a few months in order to get back in that regimen. So that's why we came up with that number.
And-
that
And
date.
and by giving them such a lead, giving them such a lead time gives no one an excuse to not make it.
Exactly, right. And Mike Sakali is great about advertising all this. We'll certainly get it on the website and any way possible. We have a message board that we could put it on as well at the transfer station, so people have an idea.
Yeah,
of
that
what
would
to
be
expect.
best. The message board probably
Yeah.
works the best.
Mhm.
And I can put it on the homepage of the town website, just as an announcement
Great.
for a little while, and then put it on the Board of Health page as well.
Oh, that's great. That's
Yeah.
a good idea.
Thanks, Rebecca. Yeah. that's
Plus, there'll be
awesome.
that many more people vaccinated by then too, so
Yeah.
that'll be fine.
Yeah. How do
Right.
you feel, Hillary, about this?
I think it's good. I think it.
Yeah.
Okay.
We've suspended it.
We
and
need,
go
we need
back.
to have it back.
Yep.
Yes, we do.
Yeah.
It's
Okay,
been-
could we have a
so-
motion? Do we need a motion, Hillary? Would you like a motion or would you
Motion
like
would be
just,
good. Yes. please.
okay,
I can,
May I have a
I can
motion?
make a motion. It's just that
Good.
we can approve the reinstitution of the purple bag as of June 1st. And we will maintain the safety precautions. Is
Yes.
that understood? For COVID safety precautions at that point also.
Sounds good.
okay. Thank you. Thank you, Jay and Mike. Thank you.
You
Thank
guys
you.
vote
All right,
on it?
Janet.
I'll
Wait,
second.
did you all second
Okay.
and vote? Okay, yeah.
Oh, sorry.
Yeah.
Our
Now we need
leader's
to vote.
here. All in favor?
Aye.
Aye.
Aye. Thanks, Gary.
Okay.
The leader's
it.
here.
Ken, you're here. You can't be quiet. You need to vote.
I couldn't vote because I didn't hear the whole thing, but I do agree that the bag should wait. You know, my phone, apologize, my phone wouldn't sign in, then you wouldn't let me in, then I had to run to my computer, so I do apologize for being a few minutes late. so.
I'm sorry. Zoom has not been my friend lately. Yesterday was a disaster for me. So it may not have been you. It may have been the Zoom that I'm working with.
Lay down,
I
lay
got
down.
to my computer. and
No,
found
lay
the
down,
computer.
lay down, down.
Okay.
Okay, so
Okay.
we're,
I'll vote for the 4-0 to extend the bags.
Yeah, Ken, we were talking about starting up pay-as-you-throw on June 1st.
Yeah, I got that much out of the conversation. Don't pay attention to that name Kathy, okay? That, I am not Kathy, okay?
okay,
You-
we got
You
you.
haven't made a lifestyle change?
No, I have not. I am identifying myself as Ken Granlund, as a male and everything else, so.
Well,
My Rebecca switches us back and forth because my wife's on the FinCom, so.
Right.
She's on
Sure.
more than I am, so. That is what it is.
I can rename you if you want, but I'm gonna see your wife in like an hour and a half, so
Yeah,
it
I
just doesn't
know.
make sense.
I know. No, it's okay. All right.
Okay, we just have to, before we get to new business, the meeting minutes. And I have one question on, did we get the notification of the abutters on the 20 Oriole Lane animal
Yes.
permit? Okay,
Yes.
we did. Okay, great,
Okay.
great. That's the only question I had.
I've read the minutes and they look okay to me. I don't know about the rest of you guys.
Yeah, they look good. They look
No, I'm
good.
fine with them also.
Yeah,
Okay, you want to make, anybody want to make a motion?
And you guys are stuck with me forever now, so
We're so happy
Yay.
to hear that, Rebecca.
I
That's great
begged
news.
her.
Make you laugh.
Good to
I
see you,
just said,
Rebecca.
listen.
It's good to see you.
I said, listen, Hillary's had enough to deal with in the last 6 months. This poor woman can't lose me. She needs me. She
There
was
you
like,
go.
she's like, do you need her or does she need you? I'm like, let's just say it goes both ways.
Yeah.
So
Yes,
I was
right.
like, I really don't want to lose the Board of Health. She's like, you don't have to.
Thank you so
We're
much.
very fortunate. Thank you,
Yes.
Rebecca.
We
Thank
really
you. That's very
appreciate it.
sweet. I just
Good to
wanted
see
to
you,
make Hillary
Rebecca.
not pull her hair out.
Right.
Because it's so pretty on the top of her head.
Isn't it adorable?
I'm gonna come by
You
with a pair of
guys.
scissors and just clip.
Just want to make sure no birds get caught in there.
Okay, so could we have a motion
A
on
motion?
accepting the minutes?
I'll move to that we accept the minutes.
January 13th and
Third-
February
And
10th.
February 10th, 2021. I'll second. I'll second.
All in favor?
Aye.
Aye.
Aye. Okay,
I think it was a good decision, the June 1st. It's going to give people plenty of lag time and no excuses.
go lay down. Go lay down right now.
I appreciate you giving me the heads up. Thank you very much. I like to
Okay,
Okay,
advertise.
thanks, Mike.
with-
Thank
And
you, Mike.
thank you,
of time.
Mike, for advertising.
Well, thanks, folks.
Thank you.
Thank you.
I'm going to
All right,
sign
have a
off.
good night,
See you next
everybody.
month, guys.
Bye, everyone. See you next month.
Bye.
Bye.